This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Dydropreg 10 tablet is a hormonal therapy aimed at addressing progesterone deficiency in women. It is essential for managing various reproductive health issues. Indications and uses. This medication is indicated for relieving menstrual pain, managing symptoms associated with endometriosis and premenstrual syndrome, and improving female reproductive health. It can also alleviate postmenopausal symptoms when used alongside estrogens. How it works. It works by supplementing the body with adequate levels of progesterone, improving the thickness of the uterine lining and alleviating symptoms related to hormone deficiencies. Directions for use. Take this medication exactly as prescribed by your physician. Swallow the tablet with a glass of water without chewing or crushing it. It can be taken with or without food, and it's best to take it at the same time each day to maintain consistent levels in the body. Your doctor will determine the appropriate dosage based on your individual condition. Possible side effects. Common side effects may include severe headaches, nausea, breast tenderness, and irregular periods. It is crucial to consult a healthcare provider if these symptoms worsen. Precautions and warnings. Use this medication with caution if you have underlying health issues such as liver or kidney problems, history of depression, or any form of cancer. It's essential to inform your doctor about any allergies or other medications you are currently taking. FAQs. 1. What is this medication used for? It is a hormonal therapy for managing progesterone deficiency. 2. How should I take it? Swallow the tablet with water as directed by your physician. 3. What are the side effects? Common side effects include headaches and breast tenderness. 4. Can I stop taking it once my symptoms improve? No, do not stop without consulting your doctor. 5. Is it safe for children? It should only be used in postpubertal girls if prescribed. Thank you for watching. If you have any questions or suggestions, please leave a comment below. We appreciate your feedback.